Hi everyone, I'm Rob Conyers. I'm head of patient experience and volunteering at Tameside and Glossop Integrated Care Foundation Trust. I'd just like to say thank you so much for everyone presenting this afternoon. It's really inspiring. I've made lots of notes on how we can kind of use your experience to support us. And what we wanted to do this afternoon is just share what we've done around the volunteer-led patient property centre. So next slide, please. So as a result of the pandemic, I'm sure everyone's aware that visiting has been restricted for a number of areas across our services. And we particularly found that people having access to essential items and messages from loved ones was becoming an area that we needed to look at. We also had a number of volunteers who came forward and said that they really wanted to help in any way to support patients. And that was really inspiring because actually the majority of our volunteers had stood down at this point because they were either shielding or because they didn't want to come into hospital or because they were just waiting to see what would happen in relation to the pandemic. So we worked with a group of volunteers and had a look at setting up a patient property centre. Now, this property centre initially was just a first point of contact for people to drop off essential items for their loved ones. So included things like hygiene items, pyjamas, clothing, and some cold food snacks that they would like. But since it started, we kind of just got really inspired by how the volunteers had led it, how they'd interacted with family members and our staff as well. And it's really had a huge impact, not just on patients because they've received items that they want, but also on their families, on their carers, and on staff because we've been able to support communication during this time. Next slide. So we took this approach because, like I said, visiting was restricted and we wanted to ensure that people had access to the items that they needed. We wanted to support families and loved ones stay in contact and be able to send messages, and actually the opportunity of talking to people and finding out what was important to them was really useful, because when they weren't necessarily getting the messages that they needed, or they felt that they weren't getting regular updates, the property team were actually able to act as a bit of a conduit between them and the ward staff. And just listening to some of the feedback helped us come up with quite a lot of other initiatives that we kind of linked to this project. So we had a look at increasing the number of telephone devices that we had on wards. We had a number of devices to support our virtual visiting, and we placed some of those in the patient property centre so our volunteers could actually go and when someone wanted to have a contact with their loved ones and the ward staff were unable to manage that, the patient property staff again could act as a support for that to take place. And we also wanted to support staff because we knew that it was a really difficult time for them, that the number of people calling our clinical areas was increasing because visiting wasn't taking place, and we knew that they needed as much support really as families, patients and carers. So next slide, please. So since we started it was really started in January, we ran the service from 9 a.m. to 5 p.m. 7 days a week, which was quite ambitious. We've not had a day where we haven't had patient property service running, and we've had volunteers kind of really lead that. We've delivered over, well, at the time of writing this, it was around about 15,000 items, but obviously that's increased since then. It hasn't stopped. And actually what we've been able to do is adapt our processes so that we haven't just delivered items, but we've also been able to support with the return of laundry and items, particularly for people who may have died, and family members weren't able to come in initially to talk to staff to pick up those items. We've been able to support that. So we've offered a really compassionate approach through our patient property centre. Like I said, we've managed to increase the number of devices we've had across the trust. And we had 11 volunteers initially trained to deliver the service. But a number of those people were offering so much time that we then looked at how we could get them into paid roles, because what we thought is that they should be recognised for their contributions. And our executive management team were extremely supportive of this and really gave us the permission and funding to be able to help this, alongside with some funding that we actually requested as part of our winter funding pressures. So we were very well supported once we'd managed to get the service up and running. We've extended the service till September, so obviously that's this month, but we're also now looking to see how we can increase the service on to at least March next year. And we've recognised that actually, even though the patient property centre might not have as many items coming through now as we're trying to reintroduce some visiting, the skills that we've got within the team can be utilised in a different way. So we're looking at how they can work with the patient experience team to link in with patients to get feedback, to support with any concerns that they might have, but also to be an offer of support to families and carers as they come in and support the visiting process. So the continued impact of this is great. We have also kind of looked at where we could actually deliver the service. So at the moment, it's delivered from our health information centre, which is based on in our main hospital site. And from running the patient property centre from there, we've now actually tried to designate that as a patient and family contact centre, because it's a great opportunity and first port of call within the organisation to manage and support people with any concerns or queries that they have. We've got 11 volunteers that have been onboarded, but that has increased, and those volunteers have supported a number of different roles now, and they've actually kind of linked in with some other volunteering services that we've got, such as our mobility scooters and TTO drop-off volunteers, to provide a more varied and diverse service using this central hub. We've made sure that volunteers who have come on have been supported by a paid member of staff, but we've also given those volunteers the opportunity to apply for those paid roles to give them experience and recognition of their kind of valued contribution and to help them with their career and development. And like I said, we've run the service for 7 days from 9 till 5 since it started, and that has not stopped. So this presentation really is a big thank you to all our volunteers who have supported us deliver that exceptional service. We've had a lot of feedback from families and patients, as you can imagine, and we just wanted to include a quote there, which we received. But actually, it's those day-to-day interactions and that day-to-day feedback that really makes a difference. When you're liaising with families, when you're creating relationships with them, and when you're able to support them in ways other than just delivering patient property, that's when we know this has really had a positive impact. We know that people will have been isolated without the support, and actually our volunteers were able to not just drop off essential items, but take messages, support phone calls, to escalate any concerns that people have, and to make sure that people felt supported during this really, really difficult time when visiting was restricted. As a result of that, some of our team who've actually been part of the patient property team have used their experience to develop their own careers. So one person's got a place in university for medicine, another is looking to go into studying nursing. We've managed to get one of our volunteers a place on our children's unit so they can explore paediatric nursing in future. And our other 3 volunteers who expressed willingness to gain employment have all had interviews at the trust, with 2 of them being successful and getting paid roles. So it's been a fantastic opportunity for them, but also for us to invest in these volunteers to ensure that they've had opportunities for development and that for those to be able to support their future career. We've used their stories to celebrate others, to celebrate success, and it's really helped us to highlight the impact of volunteering across the organisation. I think sometimes people weren't necessarily sure how volunteers could support and how they could use their skills in a range of different situations. But by creating these roles, by talking to staff and communicating with them and explaining the roles of the patient property centre and how volunteers have been able to support, it's really created an awareness about the value and the experience that volunteers bring. So these are just a couple of examples of ways that we have shared stories of our volunteers, and we've done this kind of in written format, but we've also done it through social media. It's created a lot of interest, and it's been a great way to recognise people and say thank you for their contributions. And we've had to adapt. So as you can imagine, the whole process has not been without challenges, and similar to some of the other presentations, it's kind of been a PDSA approach in terms of thinking about rapid change, understanding what we need to do, reviewing the service, learning from it and implementing new ways and practices. So we wanted to make sure we had the right skill mix of people, but also offer people development opportunities. But some of our volunteers had mobility issues. Some of our volunteers weren't particularly confident with reading and writing at the time. And what we didn't want to do is for any of those to be barriers to supporting this role. So we just had a look and we did individual assessments with them around how they could support. And through that, they came up with different ways that they could support, new ideas, and really were able to use a different set of skills and experience that we didn't necessarily recognise at first to make sure that the service was successful. We've communicated that with teams, and that's been through the individual recognition, but also through some of sharing of key messages that have come from the property service, so people know how the property service can support them, and to making sure that we're kind of really utilising their skills.